Picture a warm summer evening. You hear that familiar, high-pitched buzz. A mosquito bite is often just an annoyance, but sometimes it can carry a hidden danger. Have you ever wondered what West Nile fever is, how it spreads, and what you can do to protect yourself and your family? In this video, we'll break down everything you need to know. We'll journey from its origins in Africa to its arrival in our own backyards, explore the symptoms to watch for, and provide clear, practical steps you can take to stay safe. West Nile fever is an infectious disease caused by the West Nile virus, part of the flavivirus family. This notorious group also includes the viruses that cause Zika and dengue. Like its relatives, West Nile is primarily transmitted through the bite of an infected mosquito. First identified in Uganda in 1937, the virus was once largely confined to the Eastern Hemisphere. That changed dramatically in 1999 when it appeared in New York City. Since then, it has spread across North America, becoming a persistent public health concern. What makes this virus particularly tricky is that most infections are mild or even asymptomatic. In fact, about 4 out of 5 people infected never feel sick. However, for some, it can cause a feverish illness and, in rare cases, lead to severe, life-threatening neurological disease. The West Nile virus is mainly transmitted by the bite of an infected mosquito, specifically from the Culex genus. These mosquitoes are the primary vectors carrying the virus from its natural reservoir to humans. This cycle begins when mosquitoes feed on infected birds like crows and jays. When that mosquito then bites a human, it passes the virus along. Humans are considered dead-end hosts, meaning we don't spread it to other mosquitoes. While rare, transmission can occur through blood transfusions or from mother to baby, though screening makes this uncommon. Importantly, West Nile virus is not spread through casual human contact like touching or kissing. So what happens if you're infected? The surprising truth is that about 80% of people will show no symptoms at all. Their immune system fights off the infection without them ever knowing they had it. For the 20% who do get sick, symptoms usually appear 3 to 14 days after a bite. This milder illness, called West Nile fever, often includes fever, headache, body aches, fatigue, and sometimes a rash. However, in less than 1% of cases, the virus causes a serious neurological illness. Known as neuroinvasive disease, it can be life-threatening. Older adults and the immunocompromised are at the highest risk. Warning signs require immediate medical attention and include high fever, severe headache, stiff neck, disorientation, tremors, or paralysis. These can indicate dangerous conditions like encephalitis and inflammation of the brain or meningitis. To diagnose West Nile virus, doctors rely on blood tests to detect specific IgM antibodies your body creates to fight the infection. In severe cases with neurological symptoms, a lumbar puncture or spinal tap may be used to test the cerebrospinal fluid for the virus, confirming its presence in the central nervous system. There is no specific cure, so treatment is entirely supportive. Mild cases improve with rest, fluids, and over-the-counter pain relievers. Severe cases require hospitalization for IV fluids, pain management, and close monitoring. If the brain is affected, causing encephalitis, patients may need breathing support from a ventilator to help them through the critical phase of the illness. The goal is to manage symptoms while the body's immune system clears the infection. With no vaccine available, prevention is your best defense. Use EPA-registered insect repellents containing DEET or picaridin. Wear protective clothing like long sleeves and pants, especially at dawn and dusk. Mosquito-proof your home by maintaining screens on windows and doors. Critically, eliminate standing water where mosquitoes breed. Regularly empty water from flower pots, bird baths, and clogged gutters to disrupt their life cycle and reduce the mosquito population around your home. Understanding these steps is crucial for protection. If you found this guide helpful, please like, share, and subscribe for more health tips. Stay informed and stay safe.